And now, back to Nevada Newsmakers with Sam Shad.
And back on Nevada Newsmakers, we continue our conversation with Dr. Jonathan Tay. He heads up Reno CyberKnife at St. Mary's Medical Center here in Reno. What kind of people, well, let's start a different premise. It used to be that if somebody was going to see an oncologist, it was the end of the road for them. In the last 20 years, we've seen dramatic changes in the way that cancer is treated, correct?
Correct.
And what has been the driving force behind these changes?
Well, if you look back in the last decade, the cancer death rate has actually decreased for men and women both. And I think there are a number of reasons why, and two of them would be early screening and early detection of cancers. If you detect cancer early, you're always going to have a better chance of curing it. And the other one is improving treatments. All treatments of all different modalities of treatment of cancer is improving. Surgeons are getting better. They're able to resect more and more complicated tumors with less and less recovery and less blood loss and less complications. Chemotherapy is getting better. There are a lot of horror stories about chemotherapy and radiation, both, but a lot of the horror stories come from 10 or 15 years ago when we were less capable of dealing with the side effects. Radiation techniques are getting better. There are a lot of horror stories about radiation and all the side effects and all the long-term complications that we can cause, but a lot of those horror stories come from 10, 15, 20 years ago, whereas modern-day radiation is really well tolerated by most patients, and the CyberKnife makes it even easier.
Now, you're able to operate on inoperable tumors, correct?
Correct.
How are you able to do that?
Well, in a lot of situations, the patient is medically inoperable, meaning they're not healthy enough to undergo surgery. For example, someone with early-stage lung cancer, the gold standard has been surgical resection or lobectomy, or maybe a pneumonectomy if it's a...
In English, what does that mean?
Lobectomy just means removal of that portion of the lung that the tumor is in. But in reality, a lot of these patients with lung cancers have a lot of comorbidities. They have underlying chronic bronchitis and emphysema because they've been smoking all their lives. They might have heart disease, and they couldn't withstand a big surgery, or they couldn't withstand a big surgery without becoming a pulmonary cripple. Those patients are great for CyberKnife because in the few that we've treated so far since opening in October, some of those tumors have just disappeared with 3 CyberKnife treatments. Prior to the availability of CyberKnife, we used to treat those medically inoperable patients with a long course of conventional radiation therapy, 6 weeks to deliver a dose of what we call 6,000 centigrade. Well, now we can, because we eliminate the amount of normal tissue that's in our radiation field with the CyberKnife, we can deliver that entire dose in 3 days. And we've seen some of those lung tumors just disappear on us, and even without any scar tissue, and even without any symptoms. Not everybody will go through a CyberKnife treatment without symptoms, but certainly what we've seen so far has been quite remarkable and something we never used to see with conventional radiation therapy techniques.
How come all the other hospitals in the state have not jumped on this? Because it would seem to me, it sounds like a miracle.
I think CyberKnife is rapidly gaining acceptance throughout the world, but I think we are right on the leading edge of the curve of the CyberKnife explosion. 2 years ago, when we were looking at the possibility of CyberKnife and wondering whether it would work in this type of a population, there were only 80 CyberKnife systems in the world and 60 in the United States. In the last 2 years, that number has grown to 100 in the United States and 150 worldwide. And at that time, in 2006, there were only 22,000 cases worldwide since the invention of the CyberKnife treated on such a system. Now there have been about 60,000 cases treated worldwide.
Now, you talk about how the sooner you can find out about cancer through cancer screenings, the easier it can be to be able to treat these. What should the average person be doing? At what age should they start being concerned? And you know, I mean, do you just go for a screening just because? I mean, how do you go about that? I mean, most people, I don't think, watching or listening to this program would have a clue.
Well, everyone should have a primary care provider, a family practice doctor or a general internist that will take care of their basic needs and walk them through the process of getting the appropriate screening exams. You know, colonoscopies beginning at the age of 50, maybe earlier if there's a family history. You know, prostate cancer screening at the age of 50, again, earlier if, you know, if there's a family history or if that patient is in a high-risk population.
What did you think about that New York Times report about PSAs and the idea that people may be overtreated for prostate cancer because of the PSA results?
I have no doubt that there are many men who are treated for prostate cancer that never needed it. But my view is that you have to look at every patient individually, and this is the job of a primary care provider. Is PSA screening going to benefit this particular patient? If someone is 75, 80 years old with congestive heart failure and diabetes and high blood pressure that you cannot control, you know, what's the use of PSA screening and detecting prostate cancer, which may take 10, 15 years to become clinically significant in that particular patient? What's the use of PSA screening in that situation? Probably not very useful. But if you look at you know, the 40-year-old guy who has a strong family history of prostate cancer, a 40-year-old healthy guy who might live 20 or 30 or 40 years, that's the kind of person in whom PSA screening, I think, would be very worthwhile, because prostate cancer, just like any other cancer, if you detect it early, it's curable. If you wait 10 years, then you have a much greater prostate cancer burden to deal with, and that patient's going to be less curable, and that patient will still be alive with a otherwise long life expectancy. So I think it's very individualized, but that's something that the medical community and the urology and radiation oncology community has struggled with for many years at this point.
And that's where you got to leave it. Just one quick thought, which is in the past, the recent past, we've seen a couple of governors leave the state to get prostate cancer surgery. Sounds to me like they don't have to do that anymore with CyberKnife.
That is correct.
And that's where we got to leave it. Thank you so much. Fascinating topic. We'll be right back on Nevada Newsmakers after this timeout.
Join me in